MPS and the respective enzyme deficiencies. So firstly there is the Hurler or the She syndrome. So this is basically a defect in the MPS 1, and the enzyme deficiency is the alpha L hydrogenase. So the GAGs affected include the dermatan sulfate as well as the heparin sulfate. Symptoms include the presence of the mental retardation. There's also cause facial features, as well as there's hepatosplenomegaly and the cornea clouding. Next, looking at the next disease includes the Hunter syndrome. In terms of the Hunter syndrome, it is the MPS 2, and the enzyme deficiency is the hydrogenate sulfatase. And here the GAG that is affected, it is also the dermatan sulfate as well as the heparin sulfate. The symptoms, it includes the mental retardation. Next is the involvement of the Sanfilippo syndrome. This is type A, and the MPs involved is the MPS 3A, and the enzyme defect is of the heparin sulfate N sulfatase. Now looking at the GAG affected, the GAG affected is the heparin sulfate, and the symptoms include the delay in the developmental delay, as well as there is presence of the motor dysfunction. Next we are going to look at the Sanfilippo syndrome B. Sanfilippo syndrome B, it the MP is the MPS 3B, and the enzyme affected is the alpha N acetyl glucosamide. Now the GAG affected here is the heparin sulfate, and the symptom is same. There is a developmental delay as well as the motor dysfunction. Next, looking at the Sanfilippo syndrome C. Sanfilippo syndrome C is including the MPS 3C, and the enzyme defective is nothing but the alpha glucosamide N acetyl transferase. The GAG affected is the heparin sulfate, and the symptom is same. There is the developmental delay as well as the there is presence of motor dysfunction. Next, moving on to Sanfilippo syndrome D. So this is nothing but the MPS 3D, and the enzyme affected is N-acetyl glucosamine 6-phosphate, and the GAG affected is nothing but the heparin sulfate. Symptom is again the same, that is the developmental delay as well as the motor dysfunction.